Hello, my name is Aisling Ryan. I'm a paediatric occupational therapist and a PhD candidate at the University of Queensland. And today I'm going to be talking through our recently published article in the Journal of Developmental Medicine and Child Neurology titled Child-Led Goal Setting and Evaluation Tools for Children with a Disability, and this is a scoping review. So why are we interested in child-led goal setting? Well, the shift towards person-centered healthcare has led to growing recognition that children should be involved in goal setting. However, in current practice, intervention is most often driven by caregiver or therapist priorities. We know there are unique considerations for involving children with disabilities and delays in goal setting, including the need to consider their changing abilities across the developmental trajectory and consider the interrelated roles of caregivers and children. However, the tools and approaches that best support children to be involved in goal setting have not yet been explored. This has led to the aims of our study, which were to identify the child-led tools and approaches reported for use in goal setting and evaluation, to examine their clinometric properties and clinical utility, to understand the process steps that they represent in clinical practice, and to identify characteristics of children who are capable of self-responding. To address these aims, we conducted a scoping review, guided by the JBI Manual for Evidence Synthesis. We systematically searched 6 databases for articles related to our population of interest, which is children with a disability or delay between the ages of 0 and 18 years, our construct of interest, which is goal-setting tools or approaches used with a child self-respondent and reported in enough detail for replication, and our context of interest, which is rehabilitation or developmental therapy. We excluded articles that involved goal setting with a proxy only, where goal setting was completed jointly by a caregiver and child, and therefore the independent contribution of the child was not clear, or when the respondent to goal setting was unclear. From the over 11,000 unique articles retrieved in our searches, we identified 50 articles that met our inclusion criteria as they involved a child self-responding during goal setting and evaluation. We extracted data from these articles using the CanChild Outcome Measure Rating Form. And we saw that the children who were included in these studies were between the ages of 4 and 17 years with diverse diagnoses. Although the criteria for including children in goal setting and evaluation varied quite significantly between studies. Four tools were identified in the literature to be used with a child self-respondent during goal setting and evaluation: the Canadian Occupational Performance Measure, the Goal Attainment Scale, KIDM, and the Perceived Efficacy and Goal Setting System. The Canadian Occupational Performance Measure was the most common tool used with a child self-respondent, utilised in 31 of the included studies. 3 approaches were identified that can support children's involvement in goal setting and evaluation. The common purpose of approaches was to direct intervention towards child priorities. However, approaches differed in the underlying frameworks used, the service delivery context, and the processes implemented. And interestingly, no studies included clinometric data for child-led tools used with a child self-respondent. To understand how tools and approaches were used in the goal-setting process, we synthesized data using an abductive qualitative content analysis approach. This involved an inductive phase, followed by a deductive phase. In the inductive phase, we identified and classified tools and approaches. In the deductive phase, we categorized this data using existing goal-setting theory and clinical experience to develop a framework for child-led goal setting that could be applied in clinical practice. Results revealed 6 overarching phases of the child-led goal setting and evaluation process. We synthesized these phrases into a new DECIDE framework to support decision-making in child-led goal setting and evaluation in both clinical and research contexts. These goal phases were comprised of, first, directing children to goal setting, which were actions taken to direct children's attention to and engagement in goal setting, such as building rapport. Eliciting goal topics and priorities referred to actions taken to support children to self-identify possible goal areas and prioritize the most important goal areas that they would like to see addressed through intervention. Constructing a goal statement referred to actions taken to support children to construct a statement that represents the topic and desired outcome for each of their chosen goals. Indicating goal performance were actions taken to support children to self-evaluate each goal for their current competence in that goal, satisfaction with their competence, or confidence or readiness to address their goal. Developing an action plan referred to actions taken to identify with children an action plan to address their goal, possible facilitators and barriers to achieving their goal, and strategies and people to help address these barriers. And finally, evaluating goal progress following intervention were actions taken to support children to self-evaluate progress or goals following intervention, including re-administrating the outcome measures applied at the indicate stage. Our scoping review highlighted that goal setting and evaluation with children who have disabilities and delays should be considered a multi-phase process, and that children can be included across these 6 phases using the tools and approaches identified. However, there is a need to develop multi-phase tools which can support comprehensive goal setting with children of diverse abilities. Utilization of the DECIDE framework can guide clinicians and researchers in the steps to consider when goal setting with children, and provide a shared language for families and professionals. And we've included with this paper some clinical tools which can support clinicians, such as a goal planning sheet and a summary of the tools, approaches, and strategies. Future research should investigate the impact of child-led tools and approaches on child and family outcomes. Thank you very much for listening.